Hello and welcome to the Self-Monitored Blood Pressure webinar. I am Anna Testa, the nurse coordinator for the BeWise program, and today I will be talking to you about the self-monitored blood pressure pilot project that the BeWise program is implementing. As we all know, self-monitored blood pressure is an evidence-based strategy that has been shown to increase control of blood pressure. The objectives of this webinar are to discuss hypertension, describe the benefits of self-monitored blood pressure monitoring, or SMBP, discuss the BeWise self-monitored blood pressure pilot project, identify patients who meet eligibility requirements for inclusion in the SMBP pilot, discuss the home blood pressure monitoring consent form and how to properly complete the consent form, describe steps to create a referral in the database, properly document client education in the database, and how to demonstrate proper use of the home blood pressure monitor. So first, let's review what hypertension is, the classification of hypertension, and the burden that hypertension puts on the body. Hypertension occurs as the interior diameter of the blood vessels become constricted and the heart must pump harder to force the blood through the arteries. Imagine a garden hose that is kinked. The water must be pushed through at a much higher pressure to be able to come out of the hose. There are 4 categories for the classification of blood pressure. There is normal blood pressure, which is a systolic blood pressure less than 120, and a diastolic blood pressure that is less than 80. Prehypertension is a systolic blood pressure between 120 and 139, or a diastolic blood pressure that is between 80 and 89. Stage 1 hypertension is a systolic blood pressure between 140 and 159, or a diastolic blood pressure between 90 and 99. And stage 2 hypertension is a systolic blood pressure equal to or greater than 160, or a diastolic blood pressure equal to or greater than 100. Because hypertension can go undiagnosed for so long, symptoms do not usually appear until the body is damaged from chronic high blood pressure. So what are the complications of persistent hypertension? There are changes in the brain that can lead to stroke or aneurysm, which is a bulge that forms in an artery wall that can rupture or block nearby blood flow, or cognitive changes such as memory loss or poor focus. Blood sugar levels can increase. In the eye, ruptured blood vessels can cause vision changes or blindness. Heart attacks or heart failure can happen. There may also be peripheral artery disease, which affects blood flow to the legs. Aneurysms can also occur within the peripheral vascular system, and a narrowing of the vessels in the kidneys, which can lead to kidney failure. Self-monitored blood pressure technically refers to the regular measurement of a person's own blood pressure. SMBP more broadly refers to the regular use of a personal blood pressure measurement device that is used by the patient outside of a clinical setting. The Agency for Healthcare Research and Quality, or AHRQ, found strong evidence that SMBP plus additional support was more effective than usual care in lowering blood pressure among patients with hypertension. The AHRQ found that 3 sessions of additional support within 6 months was the minimum to impact health behavior. Let's look at a general outline of the BeWise SMBP pilot project. We'll look closer at each component of the program. BeWise health coaches will identify members whose systolic blood pressure is equal to or greater than 160 and or whose diastolic blood pressure is equal to or greater than 100 and invite them to participate in the pilot project. This is the self-monitored blood pressure agreement that needs to be filled out with the client. It is a 2-part carbon that you will have the client sign and date. Give the client the yellow or back copy and send the white copy with the consent form to be added to the patient's chart in the UCCP database. It is important that you put the phone number of the provider that you are referring the client to on the form, as the patient will need to call them if their blood pressure is too high or too low. In Salt Lake County, please put the phone number of the screening clinic on the phone. You can see the phone number will go right here. The patient will sign down here, and the health coach who has enrolled the patient in the project will sign here. When entering the BeWise values, we see the average blood pressure here in orange. Here, this client's average blood pressure is 167/108. So this patient is eligible for the SMBP project. Of course, eligibility is determined if the systolic blood pressure is equal to or greater than 160, or the diastolic is equal to or greater than 100. To create a referral in the database, you click New Referral and select SMBP from the drop-down list. This is what the SMBP referral looks like. Charting for inclusion in the SMBP program should read something like this. Client enrolled in the SMBP project. Consent form completed and signed by the client. Client verbalized understanding that she must call a provider or emergency services if blood pressure is equal to or greater than 180/110. Patient verbalizes understanding that a nurse will contact her at least weekly for blood pressure follow-up. Blood pressure monitor given and client educated on the proper use of machine. Client demonstrates proper use of blood pressure machine with return demonstration. Client states the best time to contact her is on Mondays after 2:30 p.m. Client has follow-up appointment with Dr. Pepper at the clinic on 11/28/16. And then, of course, you'll sign or initial your charting. In this case, ACTRN 11/18/2016. This is where the additional SMBP coaching, which will be provided by the BeWise Nurse Coordinator, will be charted. Local health department coaches need to provide the clients with items that will increase adherence to the pilot, increase medication adherence, and that will increase the client's satisfaction with the project. So, we'll include a home of course, the home blood pressure monitor for self-monitoring, a blood pressure log, a pill box to enhance medication adherence, and any diet or exercise tools that you see appropriate. This is the established algorithm that will be used to follow the patient's progress through their enrollment in this LSP. So it's a very busy slide, so let me just walk you through it real fast. Here the patient is screened. They get their BeWise screening with their 2 blood pressures. Of course, the patient gets provider-led risk reduction counseling at the time. And if they are determined to have a systolic blood pressure equal to or greater than 160 or a diastolic blood pressure equal to or greater than 100, they are referred to the SMBP LSP. Here we see the inclusion in the program. So we'll have the talk to them about the program, sign the waiver or agreement, teach them to use the blood pressure monitor, give them the tracker, any DASH diet information or exercise information, and of course, if they smoke, a referral to the tobacco cessation hotline. Then through their the referral to the SMBP program, I get notified of the referral to initiate case management. So within 1 week of their inclusion, I will call the client, do motivational interviewing and counseling, review their blood pressure log, troubleshoot any issues they have with their blood pressure monitor, and schedule them. If they haven't already been, I will schedule them for a funded referral for 1 month to follow up with their primary care physician or provider. Then I will consult the results of their blood pressure monitoring to the provider so they have it for when they follow up. Then I will contact the patient weekly to talk to them about their blood pressure reading until their blood pressure is less than or equal to 140 over equal to or less than 90. I'll talk to them about their blood pressure readings, medication adherence, and schedule any appointments as they are needed. Of course, I'll be consulting with their primary care provider to make sure that the patient has adequate medication. Then, at about 2 months, I'll contact the patient, get them scheduled for a funded referral for a 3-month follow-up with their primary care physician, talk to them about medications and their blood pressure readings, consult with their provider, and then provide ongoing monthly communication until their blood pressure is under control. If we look over here on this side of the chart, this is where the health coaches come into play. This is the same number of health coaching sessions the client would have, whether they are involved in the blood pressure monitoring project or not, for their blood pressure level. So of course you contact them at 1 month, you do health coaching using motivational interviewing, encourage blood pressure tracking, reduction of sodium, medication adherence, healthy lifestyles, and refer to community resources as appropriate. These are already things that you're already doing when you're doing your health coaching. 2 months the same, 6 months. And then at the 6-month appointment, I will have scheduled the patient for a follow-up assessment in the clinic. Then of course at 9 months you do their health coaching at 9 months. And then at 1 year the patient is rescreened. So it really shouldn't add a tremendous amount of work for any health coaches. Let's look at the feedback loop that will drive the client toward an optimal outcome. We have the client who performs the self-monitored blood pressure, who implements therapeutic lifestyle changes, takes their medication as prescribed, and reports their blood pressure readings to the provider or RN. The provider reviews and evaluates the SMBP readings adjusts medication and dose to achieve the goal blood pressure, and addresses adherence barriers. The health coach uses motivational interviewing to assist the patient to make lifestyle changes, provides community resources, and actions to sustain or improve medication adherence. And the nurse coordinator coordinates with both the client and the provider to achieve optimal patient outcomes, offers insights into variables affecting blood pressure, and actions to sustain or improve medication adherence. The blood pressure cuff selected for the SMBP of BeWise patients is the Omron model BP785N. Let's discuss how to set up and use the monitor. Insert 4 AA batteries and replace the cover. It is recommended that you install the batteries even if the AC adapter is used. So you plug in the AC adapter. Then we will select user ID 1 or 2. It doesn't matter which user ID is selected for the client. The settings and memory will be maintained for user 1 or 2 separately. Then we'll want to change the TRUREAD interval to 60 seconds. This means that the monitor will inflate, take a measurement, and deflate 3 times, separated by a short interval in between each measurement. The TRUREAD mode is set to off by default. However, once the TRUREAD is selected, it becomes the default. So it only will need to be done one time. When using the device, you insert the air plug into the air jack securely, and then apply the arm cuff to the left upper arm. Do not place the arm cuff over thick clothes, and be sure to secure snugly closed with the fabric fastener. So for 1 minute, let's talk about using the left arm for blood pressure monitoring. Certainly, if the patient has had a mastectomy on the left or they have had a stroke that affects the left side, we will not use the left arm for blood pressure monitoring. The recommendation that you use the left arm for blood pressure monitoring is because typically the blood pressure reading in your left arm is higher than the blood pressure reading in the right. However, if the client has higher blood pressure readings on the right, we'll want them to use the right. So barring any medical conditions, we would have the client use the left unless they have higher blood pressure readings on the right. The arm cuff will, so you select your user ID 1 or 2 and press the start button. The arm cuff will inflate automatically and take the 3 measurements in a row with a 1 minute rest in between each measurement. You will not need to press the start button again. Then we'll have the patient record the average blood pressure in a log, which the machine will average the blood pressures for the client, and then store the monitor. Let's review the proper technique for taking a blood pressure. We'll have the patient rest for 5 minutes before taking their blood pressure. That means no talking, reading, or television. We'll avoid bathing, drinking alcohol or caffeine, smoking, exercising, or eating for 30 minutes prior to taking a measurement. We'll have the client sit in a chair with back supported, feet flat on the floor, and legs uncrossed. Wrap the cuff snugly around the bare arm, lower edge of the cuff 1 inch above the elbow crease. Support the arm on a table or pillow with the middle of the cuff level with the middle of the breastbone. We'll measure blood pressure 3 times, 1 minute apart, and record all results on the blood pressure log. So how often does a patient have to monitor their blood pressure? 6 times per day. You're thinking, what? That's 3 consecutive readings, 1 minute apart, in the morning and in the evening. But how many times per week? They'll do it every day. For how long? Until the healthcare provider determines that the number of readings can be reduced. So let's recap and review the outline of the BeWise SMBP pilot project. We will include patients with a systolic blood pressure equal to or greater than 160 or a diastolic blood pressure equal to or greater than 100. The patient will be enrolled in the SMBP Health Coaching Lifestyle Program with a referral. The client will sign the BeWise Home Blood Pressure Monitoring Agreement. The patient will receive a blood pressure monitor and education on the proper use of the monitor, a blood pressure tracker, a pill box, and any related incentives. The monitor and incentives will be provided by the local health department and health coaches. Additional health coaching will be provided by the BeWise Clinical Service Coordinator. If you have any questions about this SMBP pilot project, please don't hesitate to give me a call or email me. Again, my name is Anna Testa, and I am the BeWise Nurse Coordinator. My phone number is 801-538-6437, and my email address is atesta@utah.gov. Thank you for listening to this webinar. I know that our patients receive excellent care in your hands, and this will greatly improve their control of hypertension. Thank you.